10 things that you can do to reduce your risk of colorectal cancer. This is Colorectal Cancer Awareness Month, and I'm Dr. Karen Zagian. I'm a board certified colorectal surgeon, and I'd like to share with you some things that you can do to reduce your risk. Number one, consume a diet high in dietary fiber. Dietary fiber includes foods such as fruits, vegetables, legumes, oats, and whole grains. These foods are protective for your gut. They help flourish your gut microbiome and hence reduce the risk of colorectal cancer. Number two, minimize or omit processed meats such as deli meats, bacon, pepperoni, hot dogs. All of these are processed meats that increase the risk of colorectal cancer. Omission is ideal. However, reduction in intake can also help. Number three, consume red meat in moderation, especially meat that has been charred over a grill, as this is carcinogenic and can increase the risk of colorectal cancer. Number four, get regular exercise. A lifestyle that includes regular physical activity has been linked to lower rates of colorectal cancer. Number five, avoid tobacco and alcohol, as these increase your risk of colorectal cancer as well as other cancers and other diseases. Number six, get screened for colorectal cancer. Colorectal cancer screening for average risk individuals in the United States begins at age 45. Colonoscopy is the gold standard, but there are other options as well. Number seven, know your family history of colorectal cancer and colorectal polyps. Both of these may qualify you as high risk for colorectal cancer and make you a candidate for even younger screening. Number eight, don't ignore recommendations for repeat colonoscopy surveillance if you have a personal history of colorectal polyps. Remember, colonoscopy is the only way you should be screening for colorectal cancer if you have a personal history of polyps, a personal history of cancer, a family history of colorectal polyps or cancer, or new onset symptoms that you are trying to have a diagnostic test for. Number nine, those with a strong family history of colorectal cancer as well as other cancers should consider genetic testing. Remember, in individuals with familial cancer syndromes such as familial polyposis or Lynch syndrome, colorectal cancer screening may begin in your teens or 20s. Number 10, if you're a patient with inflammatory bowel disease and you have ulcerative colitis or Crohn's colitis, you're at higher risk for colorectal cancer. The best thing you can do is to make sure that you are in touch with your GI physician and that you are on the best optimized medical therapy to keep your colitis under control and quiet. Flaring IBD in the colon is one of the biggest risk factors for IBD-associated colorectal cancer. Remember, in individuals with ulcerative colitis or Crohn's colitis, if you've had disease for longer than 8 years, we actually recommend more frequent surveillance with repeat colonoscopies every 1 to 2 years. And a bonus number 11 for early diagnosis of colorectal cancer: know your body, know your gut. If you notice a change or new symptoms that are persistent, talk to your doctors, advocate for yourselves, get screened early. Early diagnosed colorectal cancer is absolutely curable.